We begin with breaking news on the planned closure of Pawtucket's Memorial Hospital.
The Department of Health has just announced the hospital will no longer accept new patients and no surgeries will be performed.
EMS services will also no longer bring patients there. Eyewitness News reporter Steph Machado spoke with the Department of Health and has the breaking details now live from the Providence Mobile Newsroom.
Well, this is a pretty significant development as Memorial Hospital is trying to close the hospital. That application pending before the Department of Health, but the DOH today deciding that they needed to make an order the Memorial Hospital to no longer accept patients, also ordering ambulances not to take anyone to the emergency department there, and also ordering the hospital not to perform any surgery. And I just spoke to the Department of Health spokesman who said this is because of safety. They've determined that the staffing levels at Memorial Hospital are just not high enough for them to be able to perform those duties. And he said a big factor in this is that the anesthesiologist's contract was about to expire, which meant the hospital wouldn't have any anesthesiologists, which of course is necessary for many surgeries. And they were concerned about people who would come into the emergency department and might need surgery, and then they wouldn't be able to perform those duties there. And so again, this is all as Memorial Hospital has already requested to close a lot of these services, but that application is still pending before the Department of Health. There was a contentious public hearing about it last week, and there's another one scheduled for Monday. And so again, the Department of Health is saying this is because of patient safety. There are other emergency departments in Miriam and Rhode Island Hospital in the surrounding area, but ambulances will no longer be taking patients to Memorial Hospital in Pawtucket. Now, Care New England tells us that they will comply with this order. They are working on informing employees that are going to be affected and dealing with that as they are, again, trying to get this hospital closed. They want to keep some primary care services open there. We just sat down with the Department of Health. We'll bring you that interview and more information about this breaking information about Memorial Hospital coming up new at 6. Live in Providence, I'm Steph Machado, Eyewitness News.
Right, and now breaking news. We first reported live at 5. Memorial Hospital will no longer be allowed to admit patients.
This comes as Care New England works toward closing the struggling hospital. Eyewitness News reporter Steph Machado just spoke to the Department of Health. She joins us now live with what she's learned.
As the Department of Health continues to consider Care New England's application to close Memorial Hospital, they've made the decision to order the hospital to stop admitting patients and stop performing surgeries there out of concern for patient safety. The Department of Health says low staffing levels contributed to their decision to order Memorial Hospital to stop performing surgeries or accepting new patients, and ordering ambulances not to transport patients to the emergency department there.
It's really come to the point where the staffing levels are not at the necessary level where they need to be to provide safe care.
Department of Health spokesperson Joseph Wendelkin says a big factor was the impending expiration of the contract with the hospital's anesthesiologists.
Even when someone goes into a hospital just to have a routine procedure, the unexpected can happen. And hospitals need certain levels of staffing and certain clinical expertise on hand to manage the unexpected.
This all coming as the Department of Health is considering Care New England's application to close Memorial Hospital, turning it into a primary care facility. The DOH is scheduled to make a decision on that application by February 8th. And some services will remain at the hospital, including the pharmacy and the lab. And Memorial's emergency department will technically remain open, although with ambulances not allowed to go there, it would just be walk-in patients. And if those patients need to be admitted, they would then need to be transported elsewhere. And I just spoke to Care New England's spokesman who said they don't have a hard number in terms of how many layoffs there will be as a result of today's order. He said they're trying to transfer employees to other Care New England facilities, but he said there is no doubt that there will be layoffs. Live in Providence, I'm Steph Machado, Eyewitness News.